So I'd like to introduce Dr. David Holmes, who is a professor of medicine at the Mayo Clinic, and we've been very fortunate to have him here today giving us grand rounds. And we're going to hear his views on some of the questions that you have submitted. I'm Mahesh Ramchandani. Many of you know me already from your visits to this institution at Pumps and Pipes, and I'm a cardiac surgeon. So I'll start by asking a very general question. David, tell us a little bit about yourself.
Sure, Mahesh. First of all, it's great to be here. I think that as you try to look at yourself and you try to then, some of the things that you do are to try to really describe what drives you. Because I think that's an important part of it. It drives you no matter what path you have taken. It can drive you to start the path, but unless you then continue to be driven, then you'd never move along with it. You just sort of go back and forth. So I guess those things would be, once having decided on the issue of physical sciences, of which medicine is a physical science, a fundamental physical science, perhaps, maybe not the only physical science, then having done that and then identified those things that we didn't know and trying to decide whether they were things that we could finally know or things that we needed to have more information to know, those then kept that process alive where you were driven in a good way to find those things that would help and that would make a difference. And so I think that maybe the fundamental thing is we need to be driven to make a difference. You can decide what field you want to make a difference in, but we need to make sure that we are driven to make a difference.
So when do you think that spark first came to you? Do you even remember?
So there are several different things to think about. So
Yeah.
I like to discuss, and actually I like to give lectures. Now that's not necessarily an innate talent. I may or may not have a talent in that, but I like to do that. And this is a terribly embarrassing story, but it happens to be a true story. When I finished my residency at Mayo, I then went around looking at jobs, and I went to an institution and I had been asked to talk. The talk that I was given was to describe the history of CPR. After me was going to be a talk by Heimlich of Heimlich maneuver fame. I gave my talk after his talk. His talk was magnificent. I got up sort of keen to give my talk. My wife was there with me. We were seated in the front row, and I gave a talk on the history of CPR. At the end of my talk, I went back to talk with my wife, and I noticed that she had turned her name tag over. And I said, gosh, is there something wrong with your name tag? And she said, I was so embarrassed that I didn't want anybody to know that I was related to you.
Yes, I guess that might have been the reason why she did it.
She said, I listened to Professor Heimlich,
Yeah.
and then I listened to you, and I thought, where did I go wrong picking him? It was, so based upon that, then you just, that's a true story. So we then began to then say, gosh, what are the things that I could do, given the fact that you're trying to make a difference when you give a talk? You're trying to tell a story, you're trying to either bring people some interesting piece of information that they didn't know that they could apply, or tell them about the history of whatever that they're doing that could make it more exciting to do the things that they're doing, or could allow you to, or allow them to build on the future of those things that they're doing. And I had been an abject failure, not only in my wife's eyes, But it seemed like in everybody else's eyes. So,
Well, I find that hard to believe. I think that you're being
True
overly
story.
modest because,
true story.
well, whatever it is, then you've transformed yourself into one of the most engaging speakers that I certainly know. So let's go back to that first question. When did you decide you wanted to be a doctor? And why?
I like the biology, and then the interaction between hand movements and creative thinking.
Yeah.
So in college, my dissertation in college was to look at the locomotor patterns in a specific large South African toad.
Okay.
That seems incredibly mundane, except actually it's pretty neat.
Yeah.
So if you were to say, other than for some South American horses, which then go left forefoot, back left forefoot in their gait, everything else moves sort of left, far right, back left. This toad we were trying to turn into the South American horse by cutting the connection between the right side and the left side of the spinal cord to make them then just have to move one side in terms of hopping around first, and then the other side hopping around, not dragging a leg or anything like that.
Yeah.
But there couldn't be any crosstalk
Yeah.
across the spinal cord. So dealing with that and trying to design experiments related to that, and then trying to identify and make instruments that would allow you to work. This wasn't exactly before the days of electricity, but it was early. To work then in a very confined space to try to tease out and transect the spinal column and cord in such a way that you would just eliminate crosstalk from side to side. That was sort of the first thing that you said, this is pretty neat.
Yeah. Well, one question that I get asked a lot by folks that are thinking of going into medicine, and I went through this experience with my children, neither of whom have gone into medicine incidentally, is doctors work really hard. And, there's a thing with the millennials and more of a work-life balance, which may be, in fact, the better way to approach things. I mean, when you and I, were in our training, I think there was so much focus on the training and the work that, certainly in my case, I think there wasn't much of a work-life balance, and that's a real concern. How do you achieve that, given the fact that in order to get to a level of excellence in our field or any medical field, there's so much knowledge and so much experience that you need to accrue in order to do what you need to do well, and you've only got so much time. So how?
Sure, I think you then need to prioritize things. That's pretty easy to say and harder to do. One of the approaches that can be done is that you bring the children along with you, say on the weekends. You come in on the weekends to work in your study and in your office. To bring the kids along at that point in time and the grandkids along at that point in time is a really big deal to them.
Yeah.
They can bring their own things, they can bring their own work with them, but then you are working together. One of the best strategies that I can ever have experienced was a family that had trained in Rochester, and I went to their house and I was trying to decide how to do the work-life balance. They had 5 small boys. Both parents were physicians, and they had the rule that, number 1, they would always have dinner together, and they did. Number 2, afterwards, they had in their attic, they put 7 desks. After dinner, as a family, they went up and did their stuff. They could talk during that time, wasn't television or anything like that. I'm not saying that that's an awful thing, but they then did those things together, and so they then incorporated the work, which was never really a work because it was then family
What a great idea.
together.
Yeah.
And that was a hugely neat thing.
Yeah.
You did it together.
Yeah.
And most of the time, at least in my experience, it's those times that you do things together. Even if it's a short period of time, but you build that into your life. That during this time, I'm just focusing on this family thing.
Yes.
I'm not going to discuss other things. I'm going to talk about family things, and that makes a huge difference.
Yeah. Well, that's very inspiring. Now, I've got some questions over here. We had a long list of questions that were
Sure.
submitted to us by some students, and you've looked through some of them, and we'll deal with a couple that you
Good.
found to be interesting. Mac from the Village School wants to know: is medicine an art?
That's a wonderful question from the Mac at the Village School. I think the answer to that is broader than that question. I think the answer is that life is an art. I think that's the crucial thing. Life is an art. And medicine is part of life and is therefore part of that art.
So well put, yes.
I will give you a specific example about that from my own experience on those things that I have learned about medicine that then relate to the art of life. I had first come to Rochester. I was eager or aggressive first in my fellowship. I was assigned to neurology, which I liked. I like all the things, but I liked neurology. I was asked to see a patient late in an afternoon. I remember vividly, I won't tell you her name, but I remember that. She was a patient who was in her late 50s, and she then described symptoms that were absolutely diagnostic of Lou Gehrig's disease. It's an amazing physical examination. Everything fit perfectly. So I was excited about it. She hadn't been diagnosed before. There had been concerns about it, but I was excited about it. And I then called the senior consultant, who I was assigned to his service. He was a man of incredibly wonderful stature, both as a person, human, as a scientist, as a physician. And I said, "Doctor, I have a wonderful case of Lou Gehrig's disease." He said, "I'll come right over." So I was really excited to share my revelation in terms of the wonderful case. So he came into the room and we sat down, and I was going to give him the history, and he said, "Dr. Holmes, before you start, you need to remember that there has never been and never will be a wonderful case of Lou Gehrig's disease."
Yeah.
I never want to hear you say that.
Yeah.
This is a disease that affects a human person who is wonderful. It's not a wonderful disease.
Yeah. Yeah. It's a trap we all fall into as young doctors, and because we're so jazzed up by the science of what we're doing, etc. But
And
it's
so
a
that
great
message
reminder. Yeah.
was indeed the fact that we don't study diseases.
Yes.
We study people and life that happens to have
Yeah.
an illness, but it always needs to be considered in the context of who they are.
Yeah.
Because number one, that's the art of it. Number two, that's the incredible pleasure of it.
Yeah. Yeah.
There's one final example related to that. There's a whole zillion examples. In seeing what patients remember about their physicians. There was the story, which is a true story, about a physician. When he went in to see a patient, the first thing he did was to ask them what they did for fun. He would then jot that down. This was day before medical records. He would jot that down in his notes. This patient works building machines for Hormel, as an example. And every time subsequently, when he saw the patient, he pulled up his note and was able to then say, so how's the machine building at Hormel? Give me an update on that.
Yeah, yeah.
And that cemented the fact
Right.
that this was a real person
Yeah.
interested in them as a real person.
Yeah, yeah, yeah.
And that cemented the fact that indeed medicine is part of life, which is an art.
So you've highlighted in that how there's an emotional component to it. You know, we start off as scientists, you know, and helping people is part of what we do, and then I think as we mature and grow into it, the emotional part becomes more important. I've certainly found that in my case as I've matured as a surgeon. I get more attached, and it affects me more when I lose somebody. And so it's funny because there was a question, and I get asked this question all the time, but this one is from Starlin, and he says in this vein, how do you deal with emotional attachments to patients when they pass away, and does it make it harder to build relationships with other patients? In other words, does it make you want to stand off a little bit, not get so close to them, because it can be so, you know, taxing when you lose a patient? How do you deal with that?
So Starlin's a great name.
Yeah.
So think about it. You talked about Starlin as being a man. I would have said it's a woman.
Oh. Yeah.
No, it just
I didn't even think about that.
No, I mean,
Yeah.
so that's an incredibly interesting and important conversation. I would have said, given the fact that that women are more attuned to those sort of things, I would have said Starling is a woman.
Yeah. Yeah.
Be interesting to see.
Yeah.
I think the importance of that is incredibly central to the whole doctor-patient relationship. Number one, we build bonds like you do, and a surgeon builds bonds in ways that people in medicine don't build, because of the hand-on thing of you're going to do something.
Well, you're a hands-on person. Yeah.
But I think the most important thing about that is in that relationship to say, I am with you through this. I cannot guarantee immortality because most people don't live forever. And the higher risk patients, the more important this discussion is to say, I am, however, with you to the end. I will use everything in my power to make this happen, to fulfill your expectations of me, and I will expect that you will fulfill my expectations for you in terms of being an active patient, in terms of being involved in your care. And we will work together to make that happen. As then, over the course of time, if things don't go as planned, then you are still there as part of that, an integral team member with their team. And then as things continue, if they do continue to go poorly, to say, we are doing all of these things, now let us shift somewhat to making sure that we keep central in our minds and in this discussion what your loved one would want for you and for themselves.
Yes.
And then there will be times that indeed we meet obstacles that cannot be overcome. And then that becomes even more important for you to be involved, because somebody needs to help them with that grieving process, which is so essential to healing.
Yes.
And so that sort of closes that circle of that incredibly important relationship that then has gone from sort of the birth of a relationship
Right.
to the culmination of that relationship.
Yeah. Well, thank you so much for your insights. I think this is an important series of conversations for us to have for the students that are developing this interest. And these are important questions that I think are difficult to answer perfectly. There is no perfect answer, but I think it gives them some idea as to what to expect and perhaps inspires them to get on the road. Now, you've inspired many, many people and continue to do so, and you're a real example in this area. So I really want to thank you for coming here today and for sharing your insights.
It's my pleasure.
Thank you so much.
Great to visit.
Thank you. Thank you.